The owners of a youth counseling center in suburban Chicago have been sentenced to federal prison for defrauding Illinois Medicaid out of approximately $2.5 million through a fraudulent billing scheme. Between 2011 and 2018, Matheson and Terrence Ewing, co-managers of Laynie Foundation Inc., along with employee Richard Grundy, submitted false claims to Illinois Medicaid for mental health counseling services that were never provided. Additionally, they billed Medicaid for non-reimbursable activities such as internal case reviews, staff training, clinical supervision, and record keeping. To conceal the fraud, Matheson instructed staff to backdate and falsify patient records, making it seem as though a licensed practitioner had reviewed and approved certain mental health services when no such review had taken place. As a result, the three fraudulently obtained approximately $2.5 million from Illinois Medicaid and associated managed care organizations. Illinois Medicaid is a jointly funded program between the federal government and the state of Illinois, with specific guidelines for eligibility and services. All three individuals pleaded guilty to healthcare fraud charges. On Thursday, U.S. District Judge John Robert Blakey sentenced Matheson, 46, to 6 years in federal prison, while Ewing, 62, received a 4.5-year sentence. Grundy, 39, was sentenced earlier to just over 3 years in prison. Types of fraud in the case: 1. Medicaid fraud, billing for services that were never provided. 2. Billing fraud, submitting false claims for non-reimbursable activities. 3. Falsification of records, backdating and fabricating patient records to cover up the scheme. 4. Healthcare fraud, deceiving a government-funded health program for financial gain. How to detect Medicaid fraud. 1. Monitor billing statements. Patients and insurers should review billing statements for services that were never received. 2. Verify practitioner approvals. Ensure that licensed practitioners have genuinely reviewed and approved medical services. 3. Scrutinize unusual billing patterns. Look for excessive or repeated charges for the same service in a short period. Check for non-reimbursable claims. Training, internal meetings, and administrative tasks should not be billed as direct patient services. 5. Encourage whistleblower reports. Employees aware of fraudulent activities should be encouraged to report unethical billing practices. By being vigilant and conducting regular audits, both Medicaid administrators and patients can help prevent fraudulent schemes like the one carried out by Matheson, Ewing, and Grundy.